I would like any patients meeting me for the first time to know that I come from a background of blue-collar professionals and that I can really get to their level and I don't have to speak in medical terms and that we can have a normal conversation about whatever's going on and that we don't have to use any jargon for that. Something that I've learned that makes me a better doctor is to listen to my patients. It helps me to get the full story to help figure out exactly what's going on with them. The reason I chose family medicine is because it's kind of the jack-of-all-trade doctor, and I really wanted to be the person who knows a little bit about everything, not necessarily only about a certain field. The sharp experience is the whole point of going into medicine. It means offering the best care that's possible without cutting any corners. When I'm not working and I'm outside of medicine, I really like to take care of my family, host people, spend time with my friends, and mostly I enjoy cooking. One of the things I love most about my job as a doctor is being able to have a connection with my patients since I do see them on a regular basis and I really get to know them.